The Virginia Public Health Summit in Cancer is a gathering of public health stakeholders across the state. It began by simply bringing together the health district directors, right, who are the leaders, who are the executors and the developers of this health plan in their small areas. Now this has become a growing community of public health leaders and community members coming together to, again, improve the health of Virginians.
You know, when you think about cancer, the chronic diseases that lead to cancer, you know, these are not solo issues, right? It's not just about the diagnosis and treatment of the disease. Like, if we're really gonna address the prevention of these diseases, you've gotta bring the clinical sector and the public health sector together, and you've gotta leverage strategies that are about getting upstream, getting into communities, helping people change behavior. And so, you know, public health and cancer centers are perfect marriages in so many ways, and I think this conference has been a great example of the appetite that exists to bring those communities together.
I know I can say that I left last year with a new partnership that we were able to leverage for a grant that we all believed and agreed on. So I think this is necessary. I don't think that this type of conversations or collaborations could happen outside of an event like this.
Over the past 3 years, and now the fourth year, so this is the fourth summit, we have progressed in our focus from community health assessments, community health improvement plans, and now we're really trying to move the needle even further than that.
We pride ourselves on access to care and really supporting patients. So we know that access takes on many different forms, whether it's affordability, whether it's transportation, whether it's insurance coverage. And at Genentech, we really work hard to ensure that no patients left behind.
The Massey Center, the UVA Cancer Center are developing some state-of-the-art ways of treating things like breast cancer, right? And getting the community connected to that means that we're saving lives. Hundreds and hundreds of lives are being saved every month, every year, through that kind of effort.
To be clear, there aren't many summits like this, right? The reality is that when our work is people in their lives and their families and their communities, it reverberates in such a major way. It's a grounding principle when we think about the real people behind this work. And that's what was palpable in the room. So many folks, not just telling stories, they're telling people's experiences. And I think when that animates you, you can have much bigger impact.
Here we are in this room potentially creating programs with a whole concept in mind of local action for potentially national impact. Could Virginia become the next model for community health workers across the United States?